Hello, I'm Cindy with Wisconsin Voices for Recovery, and this is Speak Out on Stigma. Today we'll be hearing from Becca, Public Health Specialist Coordinator with the Southwest Suburban Health Department representing municipalities of West Dallas, West Milwaukee, and Greenfield. Hey Becca, how are you today?
Doing great. How are you?
Good, I'm good. So tell me, how does stigma harm people seeking or in recovery?
I think that's a really big question. Stigma is one of the most significant barriers to seeking treatment and sustaining recoveries for individuals with substance use disorder. Stigma fosters shame, fear, isolation. It often prevents people from reaching out to support due to concerns about judgment from family, friends, employers, healthcare providers. Stigma is deeply embedded in the language that we use, in our policies, in our treatment systems. So, from a harm reduction lens, we really try to use that person first language and avoid labeling individuals as addicts or junkies because that contributes to the stigma. And I think it reduces their struggles to more of a moral failing than the chronic medical condition that substance use disorder is. And I think a lot of people don't receive adequate treatment or life-saving interventions like medicated assistant treatment because they face that stigma and they fear the repercussions that come with it.
Absolutely. And what can be done to address stigma in the community systemically and within the structures that people with substance use disorders encounter?
I think it requires not only a multi-sector, but upstream and downstream approach. So you need to incorporate education, policy of substance use, having harm reduction strategies, kind of being at the forefront of that community conversation. So at that community level, I think education is one of the most powerful tools we can use in shifting that public perception of substance use. So replacing that stigmatizing language, like I had mentioned, with the person first terminology. So instead of saying addict, saying a person with substance use and recognizing it as the condition that it is. From a public health perspective, those campaigns help with reshaping attitudes. And then on a systemic level, I think those policies have to reflect the basic understanding that SUD is that medical condition. So if we could advocate for expansion of Medicaid, for example, to further include harm reduction services and ensure that we have more expansive access to MAT services on a systemic level, that can make so much difference. And then finally, I think we need to address the structural level. So healthcare providers, employers, social workers. We need to have everyone trained in that trauma-informed care to help reduce that bias and to help provide equitable treatment. Something that we're really trying to do in our community is embedding peer specialists who can kind of help bridge the gaps in care at that structural level.
Is there anything else you'd like to add?
I think that it's something that everyone can contribute to. You don't have to be a public health professional or involved in substance use, recovery, treatment, prevention. It can be as easy as having a simple conversation with family members about something that happens to affect most people, whether it's a neighbor or a loved one or anyone that has any use of opioids. Um, we're all very susceptible.
Yeah, thank you so much, Becca, for sharing your views on stigma. And thank you to our viewers for watching. Speak Out on Stigma is a forum to raise awareness about the harmful impact of stigma on those in and seeking recovery. Recovery is for everyone. Together, we can eliminate stigma. Don't forget to like, comment, and share this video. Thank you and have a good day.